Welcome once again to MedCognito NCLEX. It's your amazing tutor, Dr. Julia. We're diving into delegation made ridiculously simple. And yes, we have our MedCognito support contacts now. And in case you want to make some inquiries, yes, you can text on this number, +1 639 597 3198, either on WhatsApp or text. I will personally respond to you. Okay, so what is delegation? One may ask. Delegation is when the nurse is directing another one to perform some nursing tasks and activities. And it is very important because in the healthcare setting, you cannot do it all alone. So it helps to promote efficiency in the healthcare, it enhances teamwork, and it ensures optimal patient care because you can do the work all by yourself as an RN. So when you're handling any case on delegation, have these 5 rights at the back of your mind. That am I giving out the right tax? And is it the right circumstance? Am I giving it to the right person? And am I giving the right direction? Am I communicating well enough? And then right supervision. The fact that you have delegated does not mean that you are no longer accountable for that patient. You have delegated the task, but you have not delegated the accountability bit. So take note of that. So it's important that you remember the PACET method. It helps you to remember what the RN has to do, and you can, when you read through your questions, you are able to choose which one belongs to RN, which one belongs to LPN, and which one belongs to UAP. So RN does the planning. So P, planning, assessment, collaboration, evaluation, and then teaching. Teaching goes to the RN. So when there's a new client and RN has to do all the planning and set the client goals, that's for RN. Assessment, the primary assessment of the client is for the RN. And then collaboration, working with other team members, consultation with other specialists, the RN has to do that. And then evaluation, RN, the care plans, client goals, and anything that requires critical thinking, give it to the RN. And when it comes to teaching, the primary teaching, the RN has to do it, and then the LPN can reinforce what the RN has already taught. So do not forget this. Do not delegate this. Administration of certain medications via IV route, some sterile procedures, central line maintenance, and anything that requires special knowledge, skills, and judgment, the RN has to do it. So when you see any of these in your questions, remember, you do not have to delegate it. So let's look at this other rule, which will help you remember what to delegate. We use the acronym EAT. So it's more like, do not, you are the RN, do not delegate what you can eat. So E, evaluate what you have to assess, what you have to teach. Do not delegate it. So anytime you are going through delegation questions and you're getting confused, remind yourself, EAT, evaluate, assess, teach. So if a task requires nursing judgment, critical thinking, or decision making, it belongs to the RN, okay? It belongs to RN. So we are now going to go through what each of them will do, the RN, the UAP, and then the LPN. So RN, what can they do? So RN is responsible for initial and complex assessment. We have a new patient who's been admitted, RN is in charge. Post-op, RN is in charge. A new complaint, RN. Formulating nursing diagnosis and care plans, give it to the RN. Discharge and teaching instructions, like new medications, procedures, and conditions. So anytime you see that keyword new, RN has to take care of that. And then evaluation of care outcomes. Handling unstable, you see the keyword unstable, give it to the RN. And unpredictable patients. Administering IV push meds, remember I said that. Blood products, chemotherapy, central lines, and high alert medications. RN takes care of that. Performing complex procedures requiring clinical judgment. So anytime you think through what has been provided in the question, ask yourself, does it require clinical judgment? Okay, and then that should be your guide. So let's look at the LPN, more like an intermediate role. So LPN for stable clients, stable and predictable clients only. They do focus assessment, data collection, but not anything including judgment. They can administer most medications, the oral, IM, subcutaneous, depending on the states, okay? So depending on the client's states, they can give some IVs depending on the client's state. So always look out for how the question has been put. If it's an unstable patient, then you know that the RN is going to handle it. Wound care, trachea, catheter insertion, monitoring IV flow rates. They do not initiate the blood or IV push, but they can monitor the flow rates. The RN will do the teaching and LPN can reinforce the teaching, but not the initial teaching. So always watch out for that in your questions. And then the LPN reports changes to the RN. I hope we are good with this. So let's look at the unlicensed assistive personnel, UAP. UAPs are responsible for basic activities of daily living, ADLs. So bathing, feeding, toileting, ambulation, we give it to the UAP. So vital signs, weight, input, and output for stable patients. So remember the rights of delegation, the right circumstance. So you know that UAP is supposed to do the vital signs, do the weight, input, and output. But the case scenario given you, this client is unstable. So you have to look at the right circumstance. So you're not going to give it to the UAP. So specimen collection, urine or stool, CPR positioning, and then hygiene. Never assess, so they do not do the eat. Assess, they do not teach, they do not evaluate, they do not medicate. Okay, so always remember for UAP. And over here too, we have the CNAs. Yeah, UAPs and CNAs. So NCLEX would test you on a lot of the delegation principles. Remember, if client is unstable, RN. New admissions, newly post-op, less than 12 hours, post-anesthesia, chest pain, abnormal vital signs, okay? LPN will handle the stable client with expected outcomes. So a diabetic who is stable, routine wound care or predictable medications. UAP, they will help with chronic, stable, and changing conditions. So dementia, stroke with a swallowing plan, feeding, and then bathing. So these are some of the principles that can be tested for your NCLEX. So let me give you some tricks so that you will be able to choose the right answers for delegation. When you see initial, RN, newly like post-op, RN. If it's about eat, educate, teaching, evaluate, counsel, RN. Unstable, acute, critical, RN. If the teaching has been done and is about reinforcing, LPN. Okay. And routine or standard procedure, the UAP can handle it. So this mnemonic should help you as well, because the class today is to make it ridiculously simple for you. So When you see the RN question, think about brain. What do you have to use your brain? What do you have to do? A lot of critical thinking. Give it to the RN. Teaching, complex care. LPN, hence, they do the routine care for the stable clients. So the catheter, the track care, and all of that. UAP is more like a helper. Okay, so activities of daily living, bathing, help with the hygiene, the comfort of the client, and then vitals. So remember this, that when you see that question and you are in doubt, should I delegate or not? It's likely when you're in doubt, it's likely you don't have to delegate that. Keep it with the RN, because with delegation, you want to be sure that your client is safe. So whatever you're delegating, also ask yourself, will the client be safe when this is delegated? I hope that helps. So let's look at this again. We looked at it. Let's remind ourselves before we look at some questions. Do not delegate this as an RN. New admission or discharge, post-op first assessment, unstable vital signs or deteriorating condition, new orders like IV start, blood transfusion, oxygen changes, patient education, new medications, diet and procedures, sterile or invasive procedures requiring judgment. So there's a central line dressing. You have to make sure the RN handles this. You don't have to delegate. Okay. So these are some high-yield examples you can meet in the exam. You have the case of a UAP, and then it's been asked that the UAP, can the UAP take vitals for stable post-op client? Of course, yes. Can the UAP feed a stroke patient with dysphagia? No, because the stroke patient has a complex issue and there's a risk of aspiration. So the RN has to do it. So although the feeding may be part of the job for UAP, look at the right circumstance. This is dysphagia. LPN give per oral meds to a stable COPD client. Of course, yes. LPN administer IV push morphine. So remember, there are some particular medication. Morphine has its issues, so LPN cannot do it. Okay, RN only. Teach insulin injection to newly diagnosed diabetics. So you see, teaching is here, and then newly diagnosed diabetic. RN, this should not confuse you. Okay, recheck vital signs after blood pressure has dropped post-op. So right after the operation, the blood pressure has dropped. Rechecking the vital signs. Early post-op, RN will take care of that. I hope we are good. I hope we are good. So let's reinforce what we've just looked at with these scenarios before we go to the question. And I hope when we get to the questions, you will get everything correct. So who should the RN see first? So you can have scenarios like these. So the UAP is reporting blood sugar 90 after breakfast. Then the LPN tells the RN, this client is a stable pneumonia patient. The fever is 99.2 degrees Fahrenheit. UAP also reports chest pain in post-op day 1 patient. And then LPN2 is medicating a stable asthma patient. So when you look at all the three, like who is going to die quickly? It's going to be 3. The one with the chest pain, post-op, early post-op day 1. So RN must assess that immediately. Because of these keywords here, we have a stable asthma patient. This one too, stable, stable pneumonia patient. So who's going to die first? The one who reported a chest pain. Let's look at this. Which task can you delegate to UAP? Teaching ostomy care. So teach ostomy care. So teach. You can see the teach there. Monitor for hypoglycemia. Perform post-op admission assessment. So post-op, empty Foley bag and record outputs. Remember, UAP more like a helper. So UAP can do D, empty the folio bag and record the output. So watch out for these delegation red flags. Unstable patients do not delegate. Be very careful. Then judgment-based tax. Okay. Then UAP will not do education. The RN will do the teaching. And then delegation red flag asking LPN to handle the IV pushes, blood transfusions, and initial assessment. The RN has to do this. And then ignoring infection control precautions. Great. So in your test, do well to eliminate the unsafe delegation first. Look for keywords like new, initial, unstable. Always ask yourself, who is the safest here and most appropriate before you know what to delegate. And if two seem right, you pick the more qualified nurse. So you're going to give to the RN first before you think of LPN or before we give it to the UAP. I hope we are good. And always ask, what's the worst that could happen if I delegate this? If the client state is at stake, like involving death, deterioration of the condition, or even the diagnosis can be missed, remember, if safety is not assured, then the RN has to handle that. So when you're going through your test, you can have straightforward questions asking you, like, who do you delegate to? And then you can have, like, select all that apply kind of question, and you select all the tasks that maybe the UAP can do, the tasks that the RN can do, or the tasks that the LPN can do. So do well to revise that. And then you can have them in case studies as well when you're supposed to decide the roles that each team member will take. And you have it in priority questions as well. And you can have delegation and then questions where you have to make good use of your airway, breathing, circulation, and then the Maslow's theory of needs that helps you with your prioritization. Okay, so prioritization too is very important. We did it, I think, some few weeks ago. Let's all revise. So delegation is important because it's under management of care. I always keep coming to this. And for the NCLEX test plan, management of care is a high percentage, 15 to 21. So if NCLEX plays a lot of importance on that area, you also have to do well and revise it thoroughly. Okay, so let's dive right into and look at questions. All right, let's go. So when I go through the question, you know the answer, you quickly put it in the chat box. I want to quickly go through all the questions I put down for you. All right, so we started with the basics. As we move on, the questions become a bit difficult. So just like you're doing the CAT exam, it starts gradually and moves up. So let's see this. The RN is caring for 4 patients. Which task is most appropriate to delegate to the UAP? So you are the RN. So always put yourself in the clinical situation. Okay, I'm right on the ward. I have 4 clients. Which one am I going to delegate? Because this is very important, because put yourself in the clinical scenario. We have other patients, and as the RN, you have to make sure that, okay, this patient is really dying. I have to take care of this, and then I have to delegate the other tasks. Okay, so it's a life-saving task that you are able to delegate the right way. So assess the lung sounds of the patient with pneumonia. Feed a stable patient with Parkinson's disease. Teach a new diabetic how to draw up insulin. Evaluate pain relief after morphine administration. Yeah, we have B. Yeah. So you see, assess is here, teach is here, evaluate. So we do not give out what we can eat. Yes, so well done, well done. So assessment requires RN judgment. Feeding is an ADL, so UAP is stable. Teaching, RN. Evaluation, RN. Great. So let's look at this LPN delegation. Which assignment is most appropriate for the LPN under the RN's supervision? Initiating a blood transfusion in a post-op patient, reinforcing teaching about a low sodium diet, so reinforcing, performing the admission assessment on a stroke patient, titrating an IV heparin infusion. So you know that heparin is one of the critical drugs. It's been put there for a reason. So let's go, let's go, let's go. Yes, reinforcing teaching, we got it. So heparin titration, RN, admission assessment, RN, blood transfusion initiation, RN. Well done. Well done. All right, so UAP tax. This is a select all that apply question. Which task can be delegated to UAP? Obtain daily weight on a client with heart failure. Record urine output from a Foley catheter. Perform a sterile dressing change on an abdominal wound. Feed a stroke patient with dysphagia. Assist a client to ambulate with a walker. So let's go. Which will you go for? Which will you delegate? Do you need help? Yeah. So A, B, and E. A, B, and E. So routine measurement, recording urine output, then ambulation. For this sterile dressing, RN or LPN, dysphagia, because of the aspiration risk, the RN will take care of that. Okay. Well done. Yes, A, B, and E. Well done. All right. So let's look at this too. Which client is most appropriate to assign to the LPN? Patient with new onset atrial fibrillation and chest discomfort. Stable COPD client needing oral antibiotics. Patient with new confusion and high fever. Post-op hip replacement patient who just got back from PACU. So, which is appropriate to give to the LPN? So let's look for the keywords and take the right answer. Let's go, let's go. Okay. Stable, yes. So stable gives that answer away. Stable gives to LPN. Great. Which task can the RN safely delegate to the UAP? RN safely delegate to the UAP. Provide discharge teaching to a postpartum client. Records to output for a colostomy client. Monitor for fetal heart decelerations. Teach breastfeeding technique. So RN delegating to the UAP. Let's go. Safely. What can you safely? Ola, what do you choose? Let's hear from you. It's good to give it a try. Let's just give it a try. Okay, recordings to output for the colostomy client. So discharge teaching, monitoring, teaching breastfeeding techniques is out. So yes, well done, it's B. That is for the UAP. So let's look at this question under psychosocial integrity. Which task can be delegated to LPN? Lead group therapy for depressed patients. Provide routine care for stable schizophrenia patients. Assess suicide risk for new admission. Develop care plan for anxiety patients. So what is the right answer? What's the right answer? B. Yes, stable. This one gives it away. Stable schizophrenia patients. Awesome, awesome, awesome. All right, let's look at the next one. Which delegated task requires RN intervention? So more like it's been delegated, it was not supposed to be delegated. So it requires the RN's intervention. UAP, assisting a client to ambulate with gait belts. So UAP is doing that. UAP, taking vital signs before blood transfusion. UAP, collecting a clean patch urine specimen. UAP, feeding a stable dementia client. Let's go. So which one is dangerous and needs the RN's intervention? Which one is dangerous and needs the RN's intervention? Let's go. Can I see some? Yes, yes, yes. Yes, B again. Yes, yes. So UAP taking vital signs before blood transfusion. Yeah. So pre-transfusion vitals is for the RN, okay? The RN's baseline duty. Great, well done. So let's look at this, basic care and comfort. Which activity is safe to delegate to UAP? Teach range of motion exercises to stroke patients. Perform passive range of motion on stable patients. Assess mobility improvements post-PT. Create mobility care plan. So which is safe? Which one is safe? Which is safe? Which is safe? Which one is safe to delegate to UAP? So ask yourself, which one is safe? Safe and the patient will not be in any danger. Which one is safe? Teach RM exercises to stroke patient, perform passive RM on stable patient, assess mobility improvement post-PT, create mobility care plan. Yes. Everyone is, yeah. Oh, yes, so it's B. So it's B. Perform passive range of motion on the stable patient. Stable gives it away. Stable, okay? Stable. So let's look at the last but one question. I hope we are understanding delegation very well. Which medication task is appropriate for the LPN? PRN IV push morphine. Morphine. Oral antibiotics for a stable cellulitis patient. C. Assess lung sounds in the asthma patient. E. D. Evaluate relief after transfusion. So LPN, 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 LPN. Let's go. Let's go. Here's another simple one. We have millions again. Yes, yes, yes. Well done. It's B again. So stable. Stable gives it away. Stable cellulitis patient. So let's look at the last question. I hope we are really understanding. Select all that apply. Which tasks are appropriate for UAP? Select all that apply. Bathe Alzheimer's patient. Teach ostomy care to a new client. Take vital signs 1 hour after abdominal surgery. Report chest pain to the RN. And then assist ambulation after PT. So what will you pick? What is appropriate for UAP? A, D, and E. Okay, A and E. A, E, okay, you added B. B is teaching. Yeah, B is teaching. Yeah, so okay, you chose A and E. So yes, A and E is correct, but B is not part. Then report is also so A, D, and E. A, D, and E. So teaching, no. Then taking vital signs 1 hour after abdominal surgery, no. No for UAP. Well done. So bathing is ADL, activities of daily living. So the UAP can handle it. If the client is unstable, RN has to handle it. So D, the UAP can report, and then the RN interprets. And for ambulation support, the UAP can handle it. So yes, we are through for today. I hope delegation has become simple. You should do well to try your hands on a lot of questions around delegation and prioritization, and you should be fine for the exam. So I always remind you of this so that you always know the scope. Today we did a lot around management of care, which is delegation. So always know the scope, what NCLEX requires of you, and then draw your study plan and prepare accordingly. And as you are reading, you're not just reading, sharpen your clinical judgment, how you can recognize cues, analyze them, prioritize what to do per time, generate solutions, and then take the right actions, and then evaluate the outcomes that will come out of the actions that are taken. So I wish you all the best in your endeavors. We hope to see you next week. And if you need any support, I've left the contact again. Save it. You can text us, you can send a WhatsApp message based on your need, and we can see how best we can support you on your journey.